In which situations should I be alert and pay attention? What are the warning signs for me to be concerned about colon cancer, the cancer of the large intestine? Because in today's health pill, I will talk to you about 6 signs and symptoms that you should pay attention to and that should prompt you to seek medical attention due to the possibility of intestinal disease, including primarily colon, or large intestine cancer. As always, this is a health education video here on the channel, and the goal here is to provide you with good information so that you know what to do and when to take action for your health care. If you are new to this channel, I am Carlo Cunha, a family doctor, and here we talk about health, prevention, healthy lifestyle habits, and things related to your health that can have a positive impact on your life. If you enjoy this content, consider subscribing and ringing the bell below to be notified whenever I post a new video. Also, share the video and the channel with your friends, family, and people you believe this content can help. Colon cancer, or to be a bit broader and accurate, colorectal cancer, is the term used for malignant tumors that involve the large intestine. Did you know that this is the most common cancer of the digestive system? Yes, more common than stomach, esophagus, liver. And this disease is also among the most frequent neoplasms of all cancer types worldwide. It ranks third, trailing only behind lung and breast cancer in terms of frequency. This information alone justifies our vigilance towards signs that can help us identify this type of disease as early as possible. So here we go, 6 signs and symptoms that you need to be attentive to and that should prompt you to seek medical evaluation. Let me emphasize, if you experience these signs that I'm going to discuss here, it doesn't necessarily mean you have the disease, as these signs and symptoms can also appear in people with issues like hemorrhoids, intestinal worms, stomach ulcers. However, it does mean that you should, once again, seek medical help and support for a better investigation. Okay. First, bleeding in the stools, and here's a crucial point, it's not necessarily bright red bleeding, that's actually the least common type. The blood in the stools usually appears very dark, sometimes even black. It's blood that's mixed with the stool, digested blood, and often has a strong foul odor. In these cases, we need to be very alert to this differential diagnosis involving colon cancer. And in general, fresh blood that comes out with the stool during a bowel movement tends to be more related to hemorrhoids or anal fissures. The second warning sign I want to address is when there's a change in your bowel habits. A person starts having episodes of diarrhea alternating with periods of constipation. This is what constitutes a change in bowel habits. Each person has their own bowel habits. You, the viewer, you might go to the bathroom once a day, usually in the morning, after breakfast, and you do this nearly every day. People tell me in the clinic, it's like clockwork, doctor. Another person might go twice a day, or someone else every 2 days. It might vary a bit based on the person's diet for that day, but generally, that's how it is. This is the person's bowel habit. And that's what I'm talking about here. A change in this habit, alternating between diarrhea and constipation, serves as a warning sign. Fatigue, weakness, debility. These are usually more advanced manifestations. They appear as a result of anemia that the person might have due to a tumor in the intestine. The tumor in the intestine can slowly bleed, gradually, but this constant loss of blood over time can lead to anemia in the affected person, manifesting as fatigue, tiredness, drowsiness. And of course, I'm not talking about feeling this way one day or another. Often, we wake up tired, had a bad night's sleep, couldn't rest properly, had a busy day. That's not what I mean. I'm talking about a situation where a person feels like this for a month or two, and thinks, well, what's going on? It feels like I have no energy. It's like something drained my energy for daily life. It's this kind of persistent fatigue that I'm referring to. Another thing, involuntary weight loss. It's one thing to decide you're overweight, start a healthy eating program, eat better, start exercising, and then notice weight reduction as a positive result of your efforts. That's voluntary weight loss, intentional. But when a person notices they're losing weight, they have less appetite, lose interest in eating, that's when we're dealing with what I mentioned, involuntary or unintentional weight loss. This is another warning sign. The fifth symptom is more related to lesions or tumors in the lower part of the intestine, in the rectum, closer to the anus. It's what we doctors call tenesmus. It's when a person feels the urge to have a bowel movement, goes to the bathroom, but it feels like the bowel wasn't completely emptied, or sometimes it even feels like no evacuation occurred at all. This can happen because when the tumor is located in the lower part of the intestine, in the rectum, it's growing and occupying a portion of the intestine in that area. This gives a feeling of fullness, and it triggers the reflex to evacuate because there's a volume in the rectum, but since this volume isn't caused by stool but by the presence of the lesion, the person tries to evacuate but can't, or evacuates very little and still feels the sensation that I mentioned, of not having completely emptied. Lastly, abdominal pain or bloating. This can happen because a lesion of this type, when it increases in size, can cause some sort of obstruction in the intestine. This type of situation often prompts the person to seek urgent medical attention. Depending on the level of obstruction, the person can't release gas or have a bowel movement. This is why it's another important warning sign. Pay attention to these signs and symptoms. Share this video with people you believe could benefit from it. This is crucial, as paying attention to these symptoms I've discussed here can help individuals identify possible lesions of this disease as early as possible, which, as I mentioned at the beginning, is one of the most common types of tumors in our society. Identifying it as early as possible is always the best thing we can do to confront this group of diseases, regardless of the type of tumor or cancer. If you liked this content, don't forget to give it a thumbs up, as it helps a lot by making YouTube show this video to more people. Also, subscribe to the channel and hit the notification bell to receive alerts whenever a new video is posted. I'm Carlo Cunha, a family doctor, and this was my health pill for today.